Why we here ป๊าป๊า
Because we don't want to be alone.
อันนี้ว่าจัก
สวัสดีครับ
สวัสดีค่ะ Now we filming it's midnight
No, it's 1 o'clock.
after midnight yeah. What we did today
Going for a drive.
mm-hmm.
After I
To get this you didn't see that the queue mm-hmm.
yeah.
Okay.
Thai hospitals are great.
Look at that
I'm talking to you.
Okay
Talking to you.
Okay.
Thai hospitals are great. But there's some systems that we're not used to.
Look at that
Look at me.
No because they not see your face it's not good
Huh?
Look at that it's better
But they can see that
No that's it
I've also been to the hospital.
Yeah
But I went there for fun. Because I want them to cut me open a bit.
Yeah.
No, I went to
surgery
but I went to Sweden first because I have a mole that was really annoying because every time I cut my hair very short and every time I cut my hair with a machine I would cut into the mole and it would start bleeding and it hurt. And I also had one on my cheek that's the same. When I shave it starts bleeding. And I went to healthcare in Sweden and they just said it's not dangerous, it's not cancer, you're not gonna die. And I'm like it's annoying. You know, and they just laugh at me. So I don't know how you get that done in Sweden, but I guess there's some cosmetic surgery clinics you could go to privately and pay a lot of money to get it done. And in Thailand we just went to.
But here the doctor here say that if it's not hurt or anything just leave it you should not but then we made it anyway
And the cost is 5,000 baht, which is
no 5,000 plus and also 1,000
oh yeah 900 first, yeah.
So,
okay, so 6,000 baht.
Yeah.
So it's less than 2,000 crowns,
but not finished yet
less than 200 euros.
because we have to pay more for this cut and stitch
Or remove the stitches. But it's, I mean, 2,000
yeah not that
200
much
euros is nothing. Anyway, ever since we were on the plane you had a problem with your ear.
It's not in the plane it's in the house in Sweden.
Oh really?
I complain all the time that I have this ear pop and I cannot fix anything. Yeah, so it's just come on and off.
But you're Thai national, so for you it cost
30 baht.
Oh my god, how can we afford that?
I use the what you call it, this channel we call Bat Thong golden card, gold card or golden card, whatever. It's for everyone in Thailand. 30 baht to pay. Yes, but if you were, in the company or anything, you can use other channel to pay. But 30 baht is just like a very standard for everyone here. Yeah.
Anyway. So they have a queue system here that is different.
Oh yeah, this is new. This is new because we change the smart card, the ID card. You see that they have the chip. So they just changed not that long. So we use that smart card, the ID card, and then to register at the hospital first. Like you got the register everything information in the hospital, and then if you want to go to see a doctor, you have to get a queue every day.
So you blip the card.
Yeah.
And then you say I have this
and then
problem.
everything information that you have with the hospital come, and then they have like 100 channel to pick what wrong with you. what you want to see the doctor.
Oh, so you can click all 100.
Yeah. No, just one. Just one. Just one. So just shoot one at a
Wow.
time. So I click that. Yeah.
But why we here 1 o'clock at night?
Because it's the queue is you can do it just daily, day by day. So I wanna see a doctor my ear. So his specialist he have a queue just Monday and Thursday. So we come Monday. And Monday start 0 o'clock. What do you call that? Midnight, after midnight. The nurse told me actually you can come like in the morning, but she said that if you leave not far, just come midnight because the queue start midnight. And I thought that she just kidding, but no, it's seriously because when we there, at least like 20 people waited there already.
And sometimes it's more.
Yeah, and then when very like midnight, people more show up. So it's a lot. I thought that, hey.
Yeah, cars kept coming when we're.
I feel like, hey, this is seriously. This is not just kidding. It's real. I feel like it's real. You come midnight to get a queue.
But when I did the surgery, the surgeon told us to come there around noon, right?
Yeah.
And then we talked to her, and then we had to go to the surgery, the operating room.
Yeah.
And we had to wait like 3-4 hours.
This is different, China, because you have the doctor first. She know you first. So she put you to go to see her directly via the hospital. So, and she know that the operation have to start around 2:50, 2:30. So that's why she not rush us to come in the morning. You have to wait at the late afternoon anyway.
Right.
So that's why she said don't come early, it's fine. But this is me. I have to see a doctor as fast as I can because I don't want to wait all day.
But still, this is not like you have in Thailand. You also have the beauty clinics. Yeah. You do the cosmetic surgery, something. I guess they probably have faster.
No, this is government, and those thing is private. Yeah. Private you can go whenever because they welcome you all the time. So, but the price is different.
Different system, different price.
Yes.
But this is regular hospital in Singapore.
Yeah, you can say that it's mostly almost free of charge. It's great.
Except for me, who is a foreigner.
Yeah, but I feel like it's
still very cheap.
Yeah, 5,000 is still okay.
Because surgery.
Yes, this is surgery by surgeons, so it's quite good.
Right? And I didn't just do one. I did
3.
I did this
2
one,
first,
the
and
back
3
of the head, under the arm, and 2 on the back. Yeah. So it's 5 actually. 5 surgical.
In the operation room. Yeah. So it's good. Everything is not just like in the room somewhere. No, this is like very hygiene and clean.
And they had like 5 people
staff there. The nurse and everyone.
Anyway, happiness. For me, this is happiness because I don't have to bleed every time I cut my hair.
Yeah. To me, it's happiness that I feel like, when we're in Sweden, it's so difficult to reach the doctor. Because when we call, they just say that waiting, not just waiting for the answer, but waiting to go to see a doctor, which we never get that chance yet. They just say that, yeah. And then we give up by ourselves that it's okay. We okay lah.
And in Sweden, you have to call 8 o'clock in the morning.
7 o'clock.
Oh, 7 o'clock, yes. Maybe, yeah. To be able to see if maybe someone canceled their appointment during the day and you can get their time. Yeah. And then you pay, no matter what, if you just say hello to the doctor, you pay 500 crown doctor fee.
Yeah.
So, and they didn't even do anything.
Maybe you didn't even see the doctor,
Mm.
just the nurse or whatever.
Yeah,
Yeah.
and if you just see the nurse, it's like 300 or something, isn't it?
Yeah.
Swedish. So that's 30 euros to see the nurse in Sweden, and 50 euros to see the physician.
But here, 30 baht.
Yeah.
30 baht.
And
One
they do
euro,
something right
1
away.
euro, less than 1 euro.
The dentist here is the same. You went to the dentist the other day,
Yes.
and you just again different in Sweden. We have the high protection cost for medical things, so you maximum pay like 300 euros per year. So if you do go to the doctor a lot in a year, then in the end it doesn't cost anything. But until you reach that high cost of 3,000, you're gonna pay that fee. And the same for pills or whatever they prescribe you. But dentist is not part of that. So going to the dentist, you pay a lot. Like I did the root canal, I paid like 7,000 Swedish, so 700 euros.
I did this. I just call to book appointment, and I got immediately. Like I called today, and I got the next day. Yeah, like next day. So I got the queue. What time that I prefer, and reached them that they have the queue. So we got time, and then we show up. I did 2 filling the cavity and do the remove the plaque, cleaning, and then I do 2 X-ray. 3,000, less than 3,000.
Thai baht.
Yes.
So less than 100 euro.
So it's good.
And that's the other thing that is different here. You go into the dentist, they do everything. They check your teeth, they remove the plaque, they do everything, and you're done. But in Sweden, you go in, they're gonna have the examination of your mouth. Oh, okay, and then they see that okay, you need to do a filling or 2 fillings or something. So then you get a new appointment. Come back. And it's not easy to get appointments. The appointment is gonna be like 2, 3, 4 weeks in the future.
Yeah, they don't have a doctor, the dentist.
In fact, we live in Örnsköldsvik, which is the worst part in Sweden for dentistry. So there is the government dentist in Sweden, and when you move to Örnsköldsvik, you're not allowed to have. Don't put this close to me; it's gonna be echo. If you move to Örnsköldsvik, you're not allowed to go to the regular government dentist because they're full. It's only when you're born in the city that you get a spot with a regular dentist. So if you move to Örnsköldsvik, you have to, if you want to go to dentist, you have to go to one of these private clinics, which is more expensive. And it's just a really bad system, not promoting happiness. And we're not supposed to talk about the bad things, are we? But happiness. Yeah. Anyway. Yeah. But we love Thailand, and we love the Thai healthcare system. It's good quality healthcare at a very affordable cost, and contributing to a better life, higher life quality, higher quality of life.
Oh, but no. I suggest that if you foreigner, if you move here, right? I mean, if you work in some company, they're gonna provide you insurance, so that like before we did.
Yeah. I mean, if you work,
we're gonna get a very good healthcare. I mean, insurance. So we never use. Seriously, this is my first time to use
government hospital.
Yeah, both of us. Normally we use private hospital.
That's also a huge difference because we had the insurance with the Bangkok hospital, right?
Yeah,
So we went into and Bangkok Hospital is not just in Bangkok,
it's
to be
everywhere.
clear.
The big city.
Yeah. But when you go into Bangkok Hospital, you walk in the entryway, they have like 3 nurses who can tell you where you're gonna go, depending on what your problem is. You go to the next station, they have 5 nurses. They're gonna tell you that, oh yeah, okay, so with this problem, you're gonna go over there. And you get there, they have more nurses and the doctors, and they just at some point we have to wait a little bit, but almost no wait time. And you have staff to guide you where to go and really take care of you. So yeah, that's even better. But even the government hospital is quite nice.
Yeah, it's not that bad. Seriously, last time I was surprised. It's not that bad. It's good. Yeah. Good night.
Sleep tight.